berusaha untuk maju dan meraih kemandirian dengan penguasaan ilmu dan teknologi secara kreatif, inovatif, dinamis, dan berakhlakul karimah. Berusaha untuk maju dan meraih kemandirian dengan penguasaan ilmu dan teknologi secara kreatif, inovatif, dinamis, dan berakhlakul karimah. Berusaha untuk maju dan meraih kemandirian dengan penguasaan ilmu dan teknologi secara kreatif, inovatif, dinamis, dan berakhlakul karimah. Berusaha untuk maju dan meraih kemandirian dengan penguasaan ilmu dan teknologi secara kreatif, inovatif, dinamis, dan berakhlakul visi kami menjadi sebuah universitas yang unggul dalam pengembangan ilmu dan teknologi dengan berlandaskan nilai-nilai Islam untuk kemaslahatan umat.
Nursing in Faculty of Medicine and Health Sciences at University Muhammadiyah Yogyakarta has been established since 2000. It has outstanding A accreditation for undergraduate program and professional program from the Indonesian Accreditation Agency for the Higher Education in Health.
School of Nursing UMY has a commitment in developing science and technology through nursing research based on Islamic value for all people in Indonesia and Asia. Emergency nursing camp is basic life support training, especially on emergency response that organized annually with participants from national and international students. Besides that, we also conduct international nursing summer school that organized in 2 weeks to learn in the community by integrating nursing aspect, Islamic aspect, and also Japanese culture for international and national nursing students.
Apa kabar kalian di sana? Sudah berminggu kita tidak bersua. Kampus sepi rasanya. Berbulan lalu, deru kendaraan di pagi hari menghidupkan kampus. Pun kadang ada yang berlari, berpeluh agar tidak terlambat masuk kuliah jam 7. Pagi yang penuh semangat juga pagi yang menyisakan kantuk setelah mengerjakan tugas malam suntuk. Sorak semarai yang tak kenal waktu. Sekarang kampus sepi. Pagi, siang, sore, malam, semua diganti dengan keramaian virtual, saling sapa di layar kaca. Tadinya segan mengaku, tapi toh ternyata kami tetap rindu mendengar candaan kalian yang tidak kenal tempat. Kadang juga sambatan saat bimbingan, tapi lebih seru saat tukar kelakar, melihat kalian berlalu lalang antara kelas, kantin, masjid, parkiran, ruang praktek, memperjuangkan asa, menciptakan masa depan. Kami rindu melihat kerut-kerut alis kalian saat akan mengeluarkan ide-ide cemerlang. Kami rindu melihat senyum dan lebarnya tawa kalian saat yang diupayakan berhasil digenggam. Kami rindu bisa membersamai masa-masa kalian, menempa diri di sini. Badai pasti berlalu, sampai waktu itu tiba, jaga diri kalian di sana. Dari kami yang penuh kerinduan.
onegaishimasu.
Kedaruratan dan kemanusiaan adalah tugas kami. MCC, salam emergency!
Kami merencanakan kegiatan ini sampai dengan 25 Ramadan. Tapi ketika kami melihat kebutuhan dari mahasiswa, kemudian antusias dari mahasiswa yang begitu besar dan manfaat juga bagi mereka, maka kami akan insya Allah selesaikan sampai dengan akhir bulan Ramadan, itu 30 hari. Untuk buka puasa, kami itu sekitar 1.300. Kemudian untuk sahur itu sekitar 900 bungkus. Tapi implementasi dalam bentuk dukungan berupa makanan, dukungan berupa sembako kepada mahasiswa itu berupa hal yang menurut saya itu yang harus dilakukan oleh setiap orang yang mempunyai kemampuan untuk melakukan itu. Dan harapan saya ini bisa dijadikan satu contoh atau satu hal yang bisa ditiru oleh siapa saja yang mempunyai kemampuan.
Perasaan saya dapat di logistik itu alhamdulillah sangat membantu kita yang tidak bisa mudik ke keluarga, jadi sangat membantu sekali. Terus buat harapannya kedepannya mudah-mudahan UMY selalu memberikan yang terbaik buat mahasiswa dan masyarakat di sekitar.
Ini saya berhubung nggak mudik, jadi menurut saya ini sangat membantu ya, karena kan pandemi ini kayak warung-warung tuh pada tutup, meskipun sore, meskipun biasanya ramai, tapi kalau misalnya pandemi kayak gini kan yang jualan juga sedikit kan, jadi tuh kita juga was-was kalau mau beli sembarangan gitu. Kalau di sini kan ya kita selain bisa dapat gratis tanpa ngeluarin uang, jadi kita juga bisa ngehemat, kita juga kayak ya nggak mungkin kan di sini ngasihnya sembarangan, jadi kayak terjamin gitu loh, jadi kita nggak perlu takut lagi gitu. Semoga ini tuh terus berjalan gitu, mau pandemi mau enggak, jadi seluruh masyarakat di sekitar UMY ataupun mahasiswanya ataupun bukan itu tetap bisa menikmati program-program yang dilaksanakan oleh UMY sendiri.
Di sini saya juga termasuk dari salah satu mahasiswa yang tidak bisa pulang seperti itu. Dengan adanya bantuan dari kampus ini, menurut saya tuh sangat-sangat membantu sekali buat mahasiswa yang terutama kayak nggak bisa pulang ke kampung atau ke rumah masing-masing seperti itu. Dan juga saya harap pandemi COVID-19 ini segera berlalu, segera hilang dari peradaban dunia ini, dan yang terjangkit COVID pun segera disembuhkan seperti itu. Jadi kita semua bisa beraktivitas kembali seperti biasanya seperti itu.
Saya Gigi Manadi Dharma, mahasiswa asal Sumatera Selatan, sangat terbantu dengan program berbagi takjil dan sahur dari UMY ini. Kedepannya saya harap perkuliahan kembali normal dan pandemi cepat berlalu. Itu aja sih. Terima kasih UMY. Mantap.
Muhammadiyah. Established in 1912, Muhammadiyah is popularly known as the largest modernist and reformist movement of Islam in Indonesia. The character of Islam promoted by Muhammadiyah are based on the Quran and Sunnah, not following certain school of theology, law, and Sufism in Islam, but learning from each of them and adopting the strongest position based on ijtihad, promoting religious reform and stronger emphasis on amal soleh, or good deeds. Inspired by Surah Al-Ma'un, the founder of this movement, Ahmad Dahlan, introduced 4 main focus areas: schooling, preaching, healing, and feeding. Schooling.
Okay, so thank you very much. So once again, good morning to everyone.
Good morning.
Okay, so how's everyone? Are we all good? Okay, so I hope that everyone still at their best health and still safe. Okay, so we are now on our 3rd week of our field work. Okay, so if we can still remember last week, so we have discussed or we have shared so the different experiences of the 3 countries on how the COVID-19 affected the healthcare system. So each countries has presented so the different effects of COVID-19 in their healthcare systems and how these countries battle and manage, okay, so the COVID-19 cases. So for this week, or for this day rather, okay, so let me share my screen. Okay. So for this day, so we shall be discussing about the effects of COVID-19 on pregnant women in the Philippines, Indonesia, and Japan. Okay, so we all know that the pregnant women so are also considered to be vulnerable population. Okay, so in terms of the effects of the COVID-19. Okay, so for this day, so this shall be the sequence of presentation. Okay, so we will start with Indonesia, followed by Japan, and of course, lastly, we have the Philippines. So in terms of the presentation, so each country will be given 20 minutes to present. Okay, and then after the presentation, so there will be breakout session, there will be group work, okay, and each group will be given 30 minutes to share with the other students, okay, on how COVID-19 affected the pregnant women in the different countries. Then after the group work, okay, so each small group will be having a presentation. Okay, so each group you have to choose your representative who will be sharing the experiences in the different country. Then after the presentation, so there will be comments or question and answer portion. So that is what will be transpiring for today. Okay, so are we all ready for the presentations? Okay, and then later on, so again, so this will be the activity for the group work. You have to share your experiences on how COVID-19 affect the pregnant women in your country. So, good morning, Dr. Nervita. Good morning, Dr. Naruse.
Good morning, Dr.
Good
Jason.
morning. Good morning.
Good morning, Ma'am Dayan. Okay, so
Morning, sir.
and of course to all the students, good morning. So are we all ready for the presentation? Students from Universitas Muhammadiyah Yogyakarta. So you will be the one to present. Okay, so we will now give you the time to present.
Good morning.
Good morning, tell me.
Yes. The Honorable Ms. Kazuko Naruse and the Honorable Mr. Jason Rimas and Ms. Nurvita Risdiana and all friends from nursing department. Okay, at this time, I'm going to present the presentation about effect of COVID-19 for pregnant women in Indonesia. Next. Yes, we have in this presentation, we have three outlines. First outlines is death rate of pregnant women during pandemic. Second outline, antenatal care in Indonesia during pandemic. And third outline is COVID vaccination for pregnant women. Next. Okay, I will start the first outline about the rate of pregnant women during pandemic. Yes, first about the data from perkumpulan Ginekologi dan Obstetrik Ginekologi Indonesia, or the association, the Indonesian Obstetric and Gynecology Association, noted that 20% of the death of pregnant women in the last 17 months were contributed by infected by coronavirus. And then 20% of the maternal mortality rate in Indonesia is by mother with coronavirus. And in the highest increase is in July, 3 months ago, that is July. And then 560 pregnant women were reported to infected by coronavirus, and then 52% about 278 pregnant women there are positive COVID without a symptom status. And then next, yeah. And then According that the case, this condition makes obstetric and gynecology specialists alert because they are at high risk of being exposed to the coronavirus. The OGI noted that the death of obgyn doctors due to the exposure to COVID-19 reached 46 cases as of August 3, 2021. And then from IDI, Ikatan Dokter Indonesia or Indonesian Doctor Association recorded 640 doctors died due to exposure to COVID-19, such as specialist obstetric gynecology and midwives, and that time is very high, the rate of death, the practitioner. And then therefore, the acceleration of COVID-19 vaccination for pregnant women is the step towards herd immunity in Indonesia, because pregnant women are part of the family who are in the community. And then the Ministry of Health issued a circular regarding the COVID-19 vaccination for pregnant women, and the permit was granted because pregnant women are considered as one of the group at risk of exposure and with severe symptoms. Next. Maybe Hasti, you can continue the presentation.
Okay, thank you for the time. So here I'm going to continue the presentation. For the second topic, it is about antenatal care in Indonesia during the pandemic era. So here, as a pregnant woman, what can they do to protect themselves against the COVID-19? In the first picture, it shows that just like everyone, they need to obey the health protocols, such as they need to wear a mask and then washing and frequently and do the social distancing and so on. Right? In the second picture, it shows that they need to do the antenatal care, so monitoring their condition, the mothers and the baby's condition during the pregnancy. Next slide. Okay, so here is the POGI, or Indonesian Association of Obstetric and Gynecology, recommendation for antenatal care. The first one is ANC examination need to be done at least 6 times during the pregnancy. 2 times in the first trimester, and the first examination must be done at the doctor, and 1 times in the second trimester, and 3 times in the third trimester, with 1 times examination carried out by a doctor for plain childbirth. And the second one, there are some conditions that endanger the mother or maybe the baby, so it must get a stricter ANC. This condition that maybe can endanger the mother and or the baby include: one is comorbidities such as hypertension, diabetes, heart disease, and asthma. And maybe when the patient feel a weakness or maybe easily tired, because it is indicate to an anemia. And then the next is when there are an inappropriate fetal growth and when they got threat of premature labor. Next slide. Here is the details about ANC based on the POGI. The first one, when the gestational age less than 12 weeks, it can be done by phone or online, and if it's possible, it can be done by meet in person. In this part, there will be an anamnesis to screen for risk factor and knowing the complaints related to the pregnancy, and then there are also a counseling prevention of COVID-19 and counseling for pregnancy danger sign that require to visit the hospital. For the last treatment, it can be done by meeting in person or face-to-face, so the patient can go to the healthcare services. For the first one, for the next is in the age of 12 weeks, they can do the ultrasonography to confirm of gestational age and estimated birth of the baby, also screening for aneuploid if abnormalities are indicated. And in this part, they can do the laboratory check. For the next is for the 20 to 24 weeks, they can do the ultrasonography to monitoring the fetal anatomy and the fetal growth. And for the details, we can ask the patient to do the laboratory test and then bring the result for the next examination. Next, when it hit 28 weeks, they can do the ultrasonography if it is needed, and they need to evaluate the laboratory test result, also monitoring the fetal growth. In the 32 weeks, they can do the ultrasonography again to monitoring the fetal growth and then the amount of amniotic fluid and the placenta position. For the 36 weeks and 37 and the last 37 until 41 weeks, they can do the routine ACN by face-to-face. Next. Okay, so here is the flows of ANT service during pandemic based on the POGI recommendation. The first one that the patient need to do, they need to make an appointment or tele-registration for ANC service. In this part, there will be a symptom screening through the phone or online. And then it's separated by two. The first one is when in the app, in the this the in the red lines, if they got the symptoms and it leads to suspect or maybe they tested positive COVID-19, it means they need to be referred to the hospital to get the COVID treatment. And then the green line, if the result is negative, it means that there's no symptoms of COVID-19. They can continue to visit the healthcare service according to the schedule. And they also need to do the health protocol, such as wear mask and then and so on. And then when they already get to the hospital, the next step that they need to do is they need to do the screening at the entrance of health services. Usually there will be someone who will check the body temperature and then do the anamnesis about the patient condition. It also separated by two things. The first one is when the result comes out negative, which is in the green line, they can continue to the hospital and still they need to obey the rules so they can get the ANC at the hospital. Right? When the result comes out positive, if the body temperature is about 37.5 degrees Celsius, they need to do the COVID screening, such as knowing the clinical symptoms that and then the contact history, and there are the patient that are going to do the PCR and complete blood test. So if the result is still positive, then they need to be referred to the hospital to get the COVID treatment. And if the result comes out negative, then they can continue to get the ANC to the hospital. Next slide. Okay, it will continue by my friend. Thank you.
Okay, thank you. I will present about outline 3. Next slide. Okay, basically, pregnant women are one of the priority target of the COVID-19 vaccination program to reduce the risk transmission and event death due to COVID-19 pregnant women It was determined by the Ministry of Health. Vaccination, there are pregnant women, for pregnant women are can register for vaccination to vaccine service or health facilities within the government. Next slide. Nah, vaccination that are allowed for pregnant women are Sinovac, Moderna, and Pfizer, according to the alphabet. COVID-19 vaccination for pregnant women is carried out in accordance with technical instruction and rule of life uses screening format to control part of pregnant women. Next slide. Here is example of the screening form. Next slide. Based on circular letter in Indonesian regarding COVID-19 vaccination for pregnant women and screening adjustment in the implementation of COVID-19 vaccination, there are conditions pregnant women to be vaccinated against COVID-19, including number 1, next slide, body temperature. Pregnant women who want to be vaccinated must be below 37.5 degrees Celsius. And number 2 is blood pressure. And the blood pressure of pregnant women should be below 1. Then we report measured with interval of less 10 minutes. If it's still high, it should be postponed. Number 3 is gestational age. Number 4 is no 6 preeclampsia. And then no history severe allergies. Pregnant women with comorbids. Pregnant women who have disease such as heart disease, diabetes, asthma, lung disease, or liver disease must be under control and ensure that there are no acute complications. Next slide. Pregnant women with autoimmune disease undergoing treatment such as lupus must be in controlled condition and ensure that there are no acute complications. And then not currently undergoing treatment, not currently receiving immunosuppressant treatment, and last one is not confirmed positive for the COVID-19. Next slide. And however, even to have the more the requirement above, it is important to continue consult the obstetrician who handles them to see their of health status in allowed to receive the vaccination or should be postponed. Maybe that is enough. Thank you very much for your attention. And if you have question, please.
Okay, so thank you very much, students from Universitas Muhammadiyah Yogyakarta. So are there any questions or clarifications that you would want to ask to the students before we proceed with the next presentation? Or maybe later on, so we can clarify things. Oh, yes, Dr. Neruse. Your microphone is on mute.
Okay, thank you for your presentation. It is very interesting. It's very systematic, and I couldn't get blood pressure, how much it should be when the pregnant mothers have a vaccination? Blood pressure. Could you repeat it again?
Again, Dr. Narisa, what's your question with the?
My question, can you hear me?
Yes.
Okay, my question is when the pregnant mother has a vaccination, what's the criteria of the blood pressure? I couldn't get it.
So the
How
question,
much is it?
The question is if the mother is to be vaccinated. Okay, so what should be the blood pressure? Is that your question?
Yeah.
Should be the blood pressure of the mother before the mother gets the vaccine. What's the criteria before the mother can be vaccinated? Anyone from Universitas Muhammadiyah Yogyakarta? Do you have any idea?
Okay, maybe they can answer
Sorry.
later. Huh?
I'm going to answer the question. So for the blood pressure, the blood pressure of pregnant women should be, who want to get the vaccination must be below 140 and 90 millimeters of mercury. And if the result is above that, then the measurement can be repeated with an interval of at least 10 minutes. And if it is still high, then the vaccination should be postponed. Thank you.
Dr. Naruse, so the blood pressure should be less than 140.
Thank you very much.
Yes, you're welcome.
Are there any questions? Or maybe later on, so if you have something in your mind that you would want to know, so you can have that during the sharing. Okay, so at this point, so may we call on, or maybe have the students from Tokyo Medical University to present, okay, or to show us your presentation.
Okay. Hello everyone. Today, we would like to present about the effect of COVID-19 pregnant women in Japan. This is a graph of the maternal mortality rate. From 2000 to 2007, the maternal mortality rate has been on a gradual downward trend. Furthermore, the global The global average is 216 over 100,000, 0.216%, while Japan's 5 over 100,000, 0.005% is a very low figure. The next graph shows the perinatal mortality rate, which has also been on a downward trend since 2010 and is low compared to the rest of the world. These graphs show that Japan's maternal and perinatal mortality rates are among the lowest in the world, and that its maternal and child health system is well developed. Here is an illustration of the support system from pregnancy to delivery. Why does Japan have a low maternal and child mortality rate? Japan was the first country in the world to introduce the maternal and child health handbook to manage the health status of pregnant women and infants in one place. The introduction of this MCH handbook and the spread of vaccinations have greatly influenced the decline in the mortality rate. According to JICA, since 1990, a total of 50 countries other than Japan, mainly developing countries, have adopted the MCH handbook in some form. Here is a picture of the support system for pregnancy and childbirth. The Maternal and Child Health Act was amended in 2016 with reference to the Neighborhood Project in Finland. And from April 2017, it became mandatory to establish comprehensive support centers for the child-rearing generation. The goal of these centers is to provide one-stop support to all expectant and nursing mothers and their families during the child-rearing period, and to prevent child-rearing anxiety and abuse. Next, I would like to talk about the effect of COVID-19 on pregnant women. In Japan, pregnant women can receive maternal and child health care services at their local health center. However, due to COVID-19, maternal and child health services were reduced or canceled in order to prevent the spread of infection. This has resulted in pregnant women becoming isolated in the community as they cannot find anyone to talk to, and their anxiety about pregnancy and childbirth has increased. This is a very sad case that happened in August 2021, when a pregnant woman infected with COVID-19 gave birth at 29 weeks gestation, and her newborn baby died. Because no place could be found to transport her, emergency medical assistance asked 9 medical institutions, but beds were full and they could not accept her. It happened because of very few hospitals that could care for both the mother and the fetus with COVID-19. So the mother could not be admitted immediately. In response, the Society of Obstetrics and Gynecology has requested that obstetrics medical institutions secure hospital beds.
Family members are usually allowed to attend delivery. However, this has now been restricted to prevent the spread of COVID-19. It varies from facility to facility, but there are places where only partners are allowed to attend, or where only video calls are allowed. Under these situations,
we can imagine that pregnant women feel anxious and lonely. On the other hand, witnessing the birth of the child is a very important event because it's a joint effort between the couple, and it also provides an opportunity to become aware of fatherhood. Okay, next. Given the current situation, this has raised many questions and concerns regarding the effects of vaccine on pregnant and nursing mothers. These include issues about infertility, miscarriages, and its effects on breast milk. However, the Ministry of Health, Labor and Welfare has stated that there are no reports on the bad effects that approved vaccines have on pregnancy, breast milk, or reproductive organs. In fact, vaccinations are recommended based on the immunization law, and the city Saitama prioritizes the vaccination of pregnant women. Next. Midwives, public health nurses, and other professionals visit or call pregnant and nursing mothers to listen to their concerns and worries. They also provide professional care, advice, and support about the child care. Online, breastfeeding and child care constructions are also available for those who find it difficult to participate in maternal and child health services. Next. Miyagi Prefecture has established a system for accepting pregnant women. If a pregnant woman is confirmed to be infected, the public health center will conduct an investigation and report the symptoms to the professional medical coordination headquarters. Upon receiving the report, a specialist physician will then assess the health condition of the pregnant woman and decide whether she should be hospitalized or receive overnight treatment. Next. Furthermore, teenage pregnancies have also increased due to COVID-19. This may be due to factors such as the delay of sex education, the closing of schools, the increase in time away from school, abused by parents and partners, the inability to buy contraceptive due to economic poverty, and girls being approached on the street to start work in the nightlife entertainment industry. Next. To deal with unwanted pregnancies, such as teenage pregnancies, we offer pregnancy tests for 500 yen to students under 25 years old, a counseling service online, and sex education videos that promote safe sex. Okay, next. Thank you. This is all for our presentation. Thank you for listening. Thank you.
Thank you to the students of Tokyo Medical University for your presentation. Are there any questions or clarifications? Of course, again, so we will have the time later on to discuss it with your group. Okay. So we can now proceed with our third presenter from Faith Colleges. So Zelai will be presenting the effects of COVID-19 to the pregnant women.
Zelai. So good morning, everyone. Thank you, Sir Ja. So We all know that adhering to prenatal schedule can be hard during the COVID-19 pandemic because of here in the Philippines, we had lockdown and quarantine, which restricted the citizens from going out, especially the pregnant women who are more prone to the virus. So, to further understand how the pandemic affected pregnant women, we have conducted a research entitled In the Womb on a Lockdown, Stories of Prenatal Care of Multiparous Pregnant Women. Thank you. So, there is no doubt that the pandemic has greatly affected individuals from different parts of the world. This is including the Philippines. According to the World Health Organization, there were 2,227,367 confirmed cases of COVID-19 in the Philippines. This is from January 3, 2020 to September 13, 2021, with 35,145 deaths. So the increase of the cases in the Philippines initiated the government to implement various preventive measures like lockdown and quarantine, as mentioned earlier. Philippines was reported to have one of the world's longest lockdown. So Philippines, these have restricted the citizens to go out and do some activities. There is a limitation of the number of client consultations in hospitals and clinics. While some clinics temporarily closed, the doctors preferred online consultations, and pregnant women are advised to stay at home and avoid going outside, advised by the Interagency Task Force in the Philippines. So prenatal care. Prenatal care is a very important step for every pregnant woman because this helps them avoid complications, and this will educate them about essential steps they can take to safeguard and ensure a healthy pregnancy for their infants. Failure to get prenatal care puts the infant 3 times more likely to have lower birth rate, and 5 times more likely to die. So the statistics for the prenatal care, the latest statistical report made by the World Bank plus 2018 globally, women receiving prenatal care is 87.74. In the Philippines, the number of pregnant women who are receiving prenatal care increased from 85.9% in 1999 to 91.38% in 2017. This was during normal circumstances without COVID-19 pandemic. So, Horiguchi and Nakazawa reported that in the Philippines, poverty and the number of pregnancies turned out to be the factors why pregnant women fail to get their prenatal care. So we have conducted 15 interviews on the multiparous pregnant women through phone call and face-to-face interviews following strict health protocols. And the results of our research formed 2 themes, which are the constraints for compliance on getting a prenatal checkup and the prenatal care difficulties during the pandemic. So the first theme, the informants have experienced the limitations to comply with their prenatal checkup because of adhering to certain guidelines like following health protocols and having a checkup appointment. So some of the pregnant women stated that wearing face mask and face shield makes it harder to breathe, and they've had trouble because of the longer process and the need to have an appointment before their checkup. So for the second theme, the informants were restricted due to the preventive measures, thus making it difficult to get prenatal care during the pandemic. They were restricted from going out due to lockdown and quarantine. The emotions of the multiparous pregnant women were also affected by the experiences encountered during the pandemic, and the mothers felt a mix of emotions when asked about their pregnancy during the COVID-19 pandemic. They were anxious about their health as well as their infant's health, for they are more susceptible to COVID-19. According to our research, the current pandemic emergencies and the restrictive measures adopted by local governments to prevent the spread of the coronavirus infection may negatively affect pregnant women, potentially increasing the risk for anxiety, depression, and post-traumatic symptoms. So, in conclusion of our study, the researchers were able to come up with the conclusion that the COVID-19 pandemic guidelines have impacts on prenatal checkup compliance during the pandemic. They experienced limited interaction, wearing face masks and face shields, social distancing, and having checkup appointments for their prenatal checkup during the COVID-19 pandemic. Due to these experiences, their perspective on pregnancy has been affected, and they view pregnancy now as a lot more difficult compared to their previous pregnancies. And the multiparous pregnant women were also worried about their infants and their own well-being. They also recognize the importance of having savings, especially in the current pandemic. So, here are some of the recommendations the researchers have made to lower the prenatal care difficulties they experience, and to help them in complying on the prenatal care checkup. So here are the recommendations. So, conducting house-to-house interviews and online health education programs and consultations. So pregnant women should be checked comprehensively by conducting house-to-house interviews, since not all of them can go to the hospital for a thorough examination. This will help the pregnant women and the healthcare provider to detect other complications and concerns sooner, as well as avoiding the risks associated with them. So, online health education programs and consultations may help pregnant women be reminded of the information about the needs, risks, and problems that may arise during pregnancy. It will also help them to decide and plan quickly during emergencies. So, that's the end of my presentation. So, here's a video presentation to show you the situation of the pregnant women during the pandemic.
Natakot po kasi walang kasiguraduhan kung kung makukuha ni baby yung sakit or mahawa siya ganun. Tas since baby pa po, hindi pa full yung yung immune system.
Ngayon pong pandemic, natatakot po ako na manganak po tulad sa ospital po, kasi baka naisip po baka mahawaan po ako or ang baby ko. Kaya magkaiba po talaga yung pandemic ngayon or noon, kasi noon wala, ngayon po meron. Tapos po tulad nung kulang po sa pagpapacheck up. Gawa nung natakot nga po ako na lumabas dahil sa TV pa lang sinasabi na bawal nga daw po lumabas sa mga buntis. Kaya nagpa-check up ako, isang pa-check up lang. Some would already have a COVID positive result and yet they would not volunteer that information. They would just tell us that after they have been intervened. And I think that poses a great risk not only to us healthcare workers but to other patients as well. I personally know colleagues who have died from it, so it's really scary. And I'm just glad I'm working with people in this institution who are resilient enough to stay by me during this pandemic. Because exhaustion and fear, I think they have to be set aside because our patients need us.
Okay, so I'm sorry, we just have an internet connection problem. But again, so thank you very much for the presentation. So I hope you were able to learn the scenario or the condition of the pregnant women during the pandemic here in the Philippines. Okay, so are there any questions before we proceed now to the breakout sessions for the group? Okay, so maybe later on, you can still have you can still ask questions to the presenters or to the different colleges regarding the presentation of COVID-19 among the pregnant. So at this point, Dr. Nervita, so we're going to have the breakout session.
Thank you, Dr. Jason. It is a very nice presentation. And I'm very interesting with the video, the last video. I didn't mind that.
That is just one hospital in the Philippines.
Or just one hospital.
Yes. Yes.
I didn't mind that the too much patient in the pregnant woman and the children. And I want to know about the how the hospital to manage this patient and how to manage and what the prognosis in this patient in the patient in the video.
Again,
do you hear me?
Yes, yes, we can hear you. What is your question again?
I want to know about how the difficulties to manage the pregnant woman and the children, and how the prognosis. What kind of prognosis? The wellness or the are they discharged with the good condition, or some of them get worse? Okay.
Would you like to share, or I will be the one to answer?
Okay.
Yes, I'll be the one to answer. Based on the presented video, okay, so those are mothers and babies that do not have COVID. That's why, even though that's why they are placed in that area. Okay, so although it's you may have seen that it's very crowded. Okay, so but those areas are for mothers, okay, who are not infected with COVID. But you know, since that hospital presented in the video is a government hospital in Manila, and basically, most of the patients going there are poor. So that's why you can see that the setup, okay, or there are many patients in one. But rest assured that because here in the Philippines, before the mother is to deliver the baby, so the mothers must be checked first or must undergo swab test. Okay, so they must be negative first. Okay, so and then so if they are negative, so they will be placed in the ward, in the OB ward. Okay, so but if they will be positive, so they will be isolated. So in the video, those mothers are all negative of COVID. But of course, since it's very crowded, okay, so some of the mothers shared in the video that they are still afraid of having or contacting the COVID-19 because of the condition.
Yes. Thank you very much.
Okay, so maybe we can now proceed with the breakout session. Okay, and then the students. So you will be sharing, okay, so the experiences in your countries on how your countries manage COVID-19 or how your countries, okay, are affecting the pregnant mother. Okay, so I'll be the one to assign for a while. Okay, so for a minute, I'll just assign the students.
Please wait for a breakout room.
I'm just assigning the students in the breakout room, so for a while.
Okay, you can join to the breakout room.
For a while, there are still students not yet assigned.
You can join to the breakout room. Dr. Jason, Naruse
Yes, yes.
Sensei, you can room tour
Yes,
like
yes.
before. Okay.
So thank you for the help.
Yes.
So I was
most
having
welcome.
I was having difficulty in doing or assigning the students there.
Okay.
Hindi ko lang di choice natin. Erika?
Yes, sir. Na-disconnect po ako.
Yes, what room are you?
Kasama po sila Charles, sir.
Charles? For okay.
Thank you, sir.
Charles is part.
Working with mouse, sir.
Room 1, you are part of room 1. Do you see an option there for the breakout rooms that you can join? Thank you.
なんかあれだね、やっぱり。あ、あれズーム、ルーム2。あら Nobody in here.
Hello, Sensei.
Yes. Somebody in here, room 2. No?
Good morning.
Good morning. Is this room 2? No? No.
Wait.
Oh. Ah, okay. Not room. Let me go.
In between, ano nga yun, LTU. Ay, LTU ng, ano, LTUB. Oh, ang nag-post kay Are, ang ding, Oo. Ay, teka lang, sorry. May ano, hindi dito yung may pineapple. Ano pineapple? Yun, isa ro, isa ro.
Dr. Naruse, Dr. Yervita, how many more minutes are we going to give to the students? So can we give them 5 more minutes? 5 minutes.
Okay. Dr. Nurvita, I've heard, ASEAN, in ASEAN, the coronavirus pandemic is peak out. Is it
Yes,
true?
peak out. Yes.
Peak out.
Yes. We have a peak up until August, and we are staying home every day. Very high case in Indonesia on July until August, and the hospital not accept the patient because very full of patient, and nurse have a burnout of work, and they are very tired. And I am in from the university. I'm a nurse in a university. We have to go to the field to vaccinate the people, because from the hospital cannot turn down to the field because they are very tired. Yeah.
I see.
Yeah.
Okay.
That's very bad, very bad case in the last month, but now it's much better than before.
Because in Japan also the number of patients is peaked out and getting decreased. But because of with the end of the August, we had a long raining. Usually we don't have rain in August. Every day it's very shiny. But in this year, the weather was very strange and long. We had more than 1 week, over 1 week raining, strong raining. So people needed to stay at home. So that is why the numbers of the patient was decreased. And now it's a little bit stable, but still there are so many severe patients who are admitted, hospitalized, and on the ventilator. There are so many patients on the ventilator. So how about the Philippines?
In the Philippines, the cases are increasing.
Increasing.
Yes. So maybe because people are vaxxed, maybe they thought because they're already vaccinated, they sometimes neglect wearing practicing standard health, minimum standard health. So for the past week, so our cases here are more than 20,000. And we are, I guess, number 3. If not in Asia,
20,000.
yes, 20,000 cases.
Too much enough.
How about long COVID. We are now facing a long COVID. Some patients have a sign and symptom from long COVID. And I think some of them getting worse because of long COVID. How about in Japan and Philippines?
It varies. Some are very no symptoms and some are severe symptoms. And we say, first of all, they don't have symptoms, but after 1 week, suddenly the fever, headache, or diarrhea, the symptoms appeared. So, and and some people are still struggling with symptoms like a headache or fatigue or no smells or so on. More than 1 year. Some people are struggling with the problem more than 1 year. Yeah. So the situation is very varied.
Mostly definitely, patients who are vaccinated have very mild symptoms. By they are at home. Of course, patients with severe symptoms, once admitted in the hospital. Just like what we've shared last week, there are a lot of hospitals that are in full capacity. So because of the increasing number of COVID patients, those with severe.
Mr. Jason, I cannot hear you.
Hello? Do you hear me?
No.
Hello?
No.
What did
you mean? Your voice is very small. Better.
Do you hear me? Okay.
Yes.
So patients with vaccine, okay, so they just develop mild symptoms. Okay, so they stay at home. Okay, so because of the increasing number of cases, especially also with severe patients, severe symptoms, so hospitals nowadays are in full capacity. Okay, so like what we shared last time, so many patients reported in the news died inside the car. Okay, so died elsewhere because they are not admitted in the hospital. So that's the sad scenario situation in the country.
Same. You know, in Japan, there are so many people living alone and no families. People alone. So that kind of people are dying without care at home. Because the same, the hospital bed is full, and health centers said that please stay at home for quarantine. But nobody cares, and the symptoms suddenly get severe. So many people are dying at home without care.
I will just advise the students that you can now go back to the main room.
Okay.
Okay. So it is to be closed in 40 seconds. Okay, so I think everybody is here. So thank you for sharing. Okay, so your experiences with the other students. So this time, so we shall be having our group sharing. So depending on what you have discussed, so during your small group activity. Okay, so we will start. So this will be the sequence. So we will start with group 2, followed by 4, then 6, then 8, then group 1, 3, 5, then 7. Okay, so we will start first with group 2. So representative from group 2, so you may now start sharing so what you have discussed among your group mates.
Hello, good morning. I'm the representative of Group 2. I'm Mika J. Flores of Faith Colleges. So based on our short group discussion, pregnant women in Japan are giving birth alone. There are no reports of adverse effect of the vaccines in the fetus, in the reproductive system of the pregnant women. And there are also an increase of teenage pregnancy, maybe due to delay of sex education, parental abuse, working in nightclubs, and more time away from school. Then in Japan, pregnant women are also prioritized. And while in the Philippines, um, pregnant women are accompanied by their family or husband during during the time that there are no pandemic. But now there are limitations because of the pandemic. They are also prioritized in vaccination. Then there are also an increase in number of teenage pregnancy. So in the Philippines, there are prenatal care are lacking because of the poverty and because of the pandemic, since pregnant women are not allowed to go out. Then while in Indonesia, um, pregnant women are also prioritized. They are also given vaccines like Sinovac, Moderna, and Pfizer. That will be all. Thank you.
Okay, so thank you very much, group 2. Okay, so let's now proceed with group number 4.
So good morning. For group number 4, I am the representative to discuss our um, breakout session earlier. So for our group breakout session, we discussed about the current situation of prenatal care in the countries Indonesia and the Philippines. So we tackled about the number of pregnant women who have already received vaccination in both countries. So during our discussion, we learned that in Indonesia, they already vaccinated 1,754 pregnant women, while here in the Philippines, we said that we prioritize giving vaccination to pregnant women as part of our protocols. We also tackled about how pregnant women cope during their monthly pregnancy situation. So we learned that the prenatal care of Indonesia and the Philippines have same situation where we use telehealth or telemedicine as alternative to going to hospital for their checkups. That's all.
Thank you very much, group number 4. So we will now proceed with group number 6.
Yeah. Okay. My name is Pelni. I'm from Group 6, and I will present about the result of the discussion. And the discussion is about the same rules when the pregnant woman is admitted in the hospital. The rules or regulations such as the women have to antigen swab test, and the member of family can wait when the pregnant woman examination or giving birth, but they have to swab test. And then every country have rumor or issue about the pregnant woman receive the vaccination, such as in Japan. There are many rumors about pregnant women when receive vaccination, such as miscarriage or allergy, or such as impact her baby. But every government always make sure and ensure the vaccination is safe for pregnant women, but they have to consult with a doctor for the condition, because every pregnant woman is different condition to receive can receive the vaccinations. Yes, maybe it's that all the result group 6 discussion.
Okay, so thank you very much, group number 6. Okay, so how about group number 8?
So hello. During our breakout room discussion, so we discussed with the Indonesian students that they use telehealth more on their country and online health consultations through an application, and they only go to the hospital during urgent situations. And in the emergency room, there are 2 ways or parts, so they could isolate the one who is infected and those who do not have COVID-19. So they also require swab test before delivery, like here in the Philippines. Yan. Yan.
Okay, is that all?
Yes po.
So thank you very much. So we shall now proceed with group number 1.
So hello, good morning. I am Alia Mendoza of Faith Colleges. Based on the short discussion that we had earlier, I will be shortly discuss the protocols among pregnant women, followed by the admission that will be discussed by Erica. So for the protocols among pregnant women in Indonesia, if the COVID cases are high, online consultation is recommended and suggested. And then if the COVID cases are low, face-to-face are recommended. And in Japan, in a month, there are less than 100 pregnant women, and then face-to-face checkup only. And here in the Philippines, we have online checkup and face-to-face checkup. But in face-to-face checkup, you need to set an online appointment. Then for the admission that will be discussed by Erica.
So, hello, I'm Erica. So, I will be discussing the process of admission in different country. So, here's the process of admission in Indonesia. So, the pregnant women need to have a swab test first, and then if they tested negative, then they can have consultation at the hospital. But if they tested positive, they will be isolated at home, even if they are asymptomatic. But in some cases, so like emergency cases, if they need to deliver their baby, then they are allowed to give birth at the hospital, since there is no birthing homes or lying-in clinics in Indonesia, unlike here in the Philippines and in Japan. So while in Japan, they also need to have swab test first. Whether if they tested positive or negative, they can have direct consultation at the hospital, but they can also give birth at birthing homes or lying-in clinics. So here in the Philippines, just like in other country, we need to have a swab test first. Then if the pregnant women tested negative, they can give birth at the hospital, or they can have consultation in the hospital or in lying clinics. But if they tested positive, they are only highly encouraged to give birth at the hospital. That's all.
Okay, maybe I'm from the first group, group 1. I want to add some about the mental health of the pregnant woman. The pregnant woman must be very confused about how and they must to give birth. Many of the pregnant women must experience anxiety related to their condition and the condition of their factors as well. Because if they are experience the COVID-19, it is not just the pregnant woman, but also their babies. Uh, because of that, the pregnant woman need to increase their knowledge. The knowledge of the pregnant woman is one of the factors that determine the compliance of the pregnant woman. The better the knowledge they gain, the more they will obey the health protocol. Okay, that's all from the group one. Thank you.
Okay, thank you very much. Okay, and we now proceed with group number 3.
Okay, good morning. So I will be representing group number 3. So here we have talked about the different vaccines available for the pregnant women. So first, in Japan, they are only providing or they are giving Moderna and Pfizer, which is available free, which is also free for pregnant women. And then in Indonesia, they are giving Sinovac and Moderna. And then here in the Philippines, we are giving different vaccines that are available as well for pregnant women. So those are also free, given by the government. And then with regards to the admission as well, which was discussed also by the other groups, all of us have to undergo swab test or RT-PCR test before being admitted in the hospital. So if you are negative, um, you will be admitted and have and and avail the services there. But if you are positive, either you have to be isolated at home or have isolation room in the hospital. So it is crucial, and um, it is still far more than we need to study, because uh, it is critical for pregnant women and for the child to be admitted at the hospital, because of course the exposure of different diseases and the COVID. So we also need to maybe encourage the birthing homes to be available for different mothers, especially now that the hospitals are being in full capacity. So that's all. Thank you.
Thank you very much, group number 3. So we now proceed with group number 5.
So hi, I am Mara Angela Torres. I will be discuss about the Indonesia, and Brenda, we will discuss about the in the Philippines. So the number of pregnancy in Indonesia are 3 times increased. So before women go to the hospital, they have to check first their conditions. If they conditions are not well, so they can use video calls, telephones to consult with their doctors. So if their pregnancy is 12 weeks, they can meet the facilities face to face. And the pregnant women are the priority in this pandemic. So if in vaccination, they must be first screened, check vital signs. The blood pressure are under 140. And then pregnant women have comorbidities. They must check up their health first. And for the immediate care, it depends on the condition. So also pregnant women are allowed to give birth in the hospital. And Brenda?
Okay, thank you, Mara. So we discuss about the Philippines. A pregnant woman in Philippines get scared to come to hospital because they're scared get infected by COVID-19 for their own and her baby. And then in Philippines, they didn't have enough facilities for pregnant women. So pregnant women in Philippines can give birth in house and must have professional health workers, similarity like doctor is midwife or komodrona in Philippines side. So the pregnant woman who positive must be isolated, and the room for the pregnant woman is only for pregnant women, so they not together with other. Uh, and in the pandemic, pregnant women difficult to get the facilities from health system, and they having stress, and because they can going out. I think enough.
Okay, so thank you very much. And we are down to our last group number 7.
So good morning. I am Anne-Marie Sofia Siha Bonillo, and I'll be the representative of group number 7. So I'll be sharing the group discussion that we had earlier regarding the experiences, our experiences on how COVID-19 affect pregnant women in our country. So for Indonesia, in terms of the admission of pregnant women in hospital, so they said that they do not experience a shortage of hospital beds. So there are still many hospital beds still available. So not a lot of pregnant women also are being admitted in the hospital, and they do not stay in the hospital for too long. So if they are already in a good condition, so they can go home. So in terms of vaccination, so pregnant women are still one of the priorities of the vaccination program in Indonesia, since they are also prone of acquiring the virus. So in terms of the vaccination, it was also discussed earlier that if pregnant women are being assessed or screened for their vital signs or any history of diseases, and stated that if the blood pressure is higher than 140/90 millimeters of mercury, so they must rest for 10 minutes. And if their BP is still high, so the vaccination must be postponed. So pregnant women also do online consultation most of the time during pandemic in Indonesia. So in the Philippines, so online consultation are also done for the pregnant women, and they are also advised to stay at home due to high risk of contracting the disease. And just like what is showed in the video earlier, so we discussed that most hospital beds in the Philippines are in full capacity, and pregnant women who are COVID-19 negative or tend to share beds, while while patients who are COVID-19 positive are in isolation area. So, but although the pregnant women in the ward are still in fear of getting the virus, even though they are COVID-19 negative, they are still in fear of acquiring the COVID-19 virus because of the overcrowding of the place or in the hospital. So also, there are some pregnant women who choose not to go to hospital because of the fear of acquiring the virus. So they are feeling anxious and stressed with the situation. So in some communities, some pregnant women choose to give birth at home due to financial problems also. So in terms of vaccination program in the Philippines for pregnant women, so pregnant women are also part of the priority groups in getting the vaccine. So it was asked earlier, since we are doing quarantines and lockdowns. So even though we are having lockdowns, so we have different classifications of lockdowns. So it depends on the locality on what type of quarantine classification there will be. So the schedule of vaccination will depend on that quarantine classification. Thank you.
Okay, so thank you very much for all your sharings. And it seems that Okay, so the three countries have the same experience or have the same effects, okay, as to how the COVID affected the pregnant women. Okay, so at this point, if there are any questions, okay, so regarding the three countries, okay, handling of the COVID-19, okay, towards the pregnant women, so you may now ask the questions. If there are any questions or clarifications that you would want to ask, okay, so you may now do so. Yes, Charles.
Okay, I will be asking because here in the Philippines, we have programs for pregnant women that we also give vitamins, medicines for free. I would like to ask in Japan and Indonesia if they also have any programs like that, free vitamins or free medicines.
Okay, so just like what Charles has mentioned, so in the Philippines, so the Department of Health has programs for different mothers, such as giving free medicines, free uh, vaccines. Okay, so are the other two countries, okay, have also the same. Are this part of your prenatal care, prenatal services, Indonesia in Japan? Because although our country is experiencing a pandemic, so even before, so the pregnant mothers, aside from going to the hospital for their checkup, so they can visit the health centers, the rural health units. And the rural health units provide vaccines, vitamins, and other medications for free. Okay, so the health centers are the ones providing the antenatal care for the prenatal, okay, and as well as with the postnatal care for the patient. These are all for free, okay, if the pregnant mothers, of course, will be availing the services of the barangay health stations, the rural health. Okay, so how about for the other countries?
Sir, ask ko na lang po siguro in Japanese.
Okay.
Ano, 日本は例えばフィリピンはね、フリーのメディシンとビタミンあるです。お母さんたち。日本は、プログラムあれですか？フリーの、メディシンとビタミン。
誰か。
チェックアップが14回無料券です。
薬代はただじゃないですよ、日本は。検診代だけですよ。
vaccination and examination is free, but medicine is not free.
Read your question, Charles. So their examinations are free, but medications, medicine. How about in Indonesia?
Japan 日本は出産はどこでするの？助産院か病院だよね。で、そこではどうなんですか？
Ahmadiyya. Do you have any idea about pregnant mothers? Are they receiving free medicines, free services?
I'm sorry, your voice is not clear.
Yes,
Yeah, I see. Free from government. The pregnant woman in Indonesia, we have like assurance. Yes, as the woman who have assurance, they have a free. They have a free the from antenatal care until labor, but not every woman in Indonesia have assurance. So the government just give the free program just for the people who have who join in assurance program. Because in Indonesia, so many people and we have so many pregnant women, so the government don't have any facility to give the pregnant woman freely.
Okay, so thank you.
Yeah.
So how about other questions? I have a question. Here in the Philippines, aside from the hospital, so we have birthing homes, okay, so which are managed by the rural health units. So they have that also. Are the pregnant mothers, they only go to the hospital or do they go to birthing homes also? Or do you have it in your country? Birthing homes or delivery, aside other than hospital, where the mothers can deliver their babies, which are not part of the hospital.
バーシングホームっていうのがあって、出産だけするところがあるんですよ。で、そういうような施設ありますか？
In Japan, pregnant women give birth to children in maternity homes or hospital. Midwives really come home.
Organize.
Organize. Midwife will check up, organize, and attend the delivery. Delivery.
So, so the midwives are the one attending the delivery, the checkup. Okay, so same with the Philippines. Okay, so aside from the hospital, so in the birthing homes and maternity homes, midwives, okay, are the ones attending to the delivery. How about in Indonesia?
Okay. Who will answer, my student? I will deliver this to my student first, and I will add the question.
Okay. Students, do you have
Hello,
any
students.
idea if aside from the hospital, are there maternity clinics, birthing homes in your country, wherein others can go to deliver the baby?
Good Jason, I will try to answer because my student they confused to answer. Okay. In Indonesia, we have a nursing home, but not specialist for midwifery, not specialist for maternity, because we have a rule that the pregnant woman should attend to the hospital or to the clinical for mother. We have a special clinic for mother and baby, and we call it the hospital mother and baby, not the hospital. So in Indonesia, they usually attend to the hospital mother and baby. And in our program, we don't have a nursing home who attend to the host, but they should go to the facility. But in some case, in the village and in the village, some pregnant women still they didn't go to the hospital and they delivery at home by traditional midwifery in some case, but it is very rare because there's too dangerous. But some cases still. Okay, thank you.
Okay, so thank you very much. So that is also the same here in the Philippines. Okay, are there any questions, clarifications? Okay, it seems that I think there are no more questions because we just have experienced the same. Okay, so this pandemic, okay, affected our countries. Okay, so just the same. Okay, and the same as with how we handle. Okay, so the pandemic in terms of pregnant mothers that are affected by COVID-19. Okay, so there are no unusual or unique ways in dealing with this problem. Okay, so I guess are we all good at it? By the way, so there is this in the chat box. So don't forget to fill out the attendance. Okay. So it's posted in the chat box. So please click that link and please register. Okay, so since there are no more questions and clarifications, okay, so next Friday, so our topic will be so understanding the effects of COVID-19 among the elderly. Okay, so I guess that is our last discussion, and then the other one would be the culminating activity, right? So are we all good? Are we all good for today, Dr. Nervita, Dr. Naruse? Are there any last words that you would want to tell the students before we leave this Zoom meeting?
Okay, thank you very much today. I think it is very interesting, and I understand that the situation of Japan is delayed, delayed you, because you are very encouraged pregnant women and mothers and prioritizing the vaccination, but in Japan, until August, government doesn't encourage the mothers to have a vaccination. After death of the newborn baby at 29 weeks, who delivered at home, since then, the government started to and to encourage the mothers to vaccinate. So I think Japanese system is still weak on the taking care of the mothers, pregnant mothers and the child, and we need to think about those points in this under the pandemic of the COVID-19. Thank you.
How about you, Dr. Nervita?
Okay, thank you very much. This is a very interesting and I think that every country have they have own unique, and we can learn each other. I think because the same like you said before, in some case, and in Indonesia, I have some case that most of the pregnant women who have a COVID have the hypercoagulation, and this make the mother getting worse. And some of case the baby can deliver well, but the mother because the hypercoagulation, and she was died in some case like that. I think thank you very much. Enough from me.
Okay, so thank you very much once again. So I guess so we're good for today. So we will see each other next Friday. Okay, so once again, so thank you. Arigatou gozaimasu. Terima kasih. Salamat.
Sir, photo opo.
Okay, thank you.
Thank you.
Bye-bye.
Thank you. Bye-bye.
Thank you. Sergia.
じゃあそこに出た出席を書いてください。
Dr. Naruse. Sergia. Take tayo ng photo op ng third day. Tinatawag ka ni Charles kanina.
Sorry. Okay, so for those who are still here, so for a while, so let's have first photo op, group picture.
戻ってきた。
Okay, so Stephanie, Vin, are you still here?
Yes, po, sir.
Okay, so Vin,
picture.
1, 2, 3.
これ誰で撮らないと。これをどうやって撮ればいいのかわからない。
1, 2, 3. Thank you po.
Okay, so thank you again. Bye-bye.
1, 2, 3はいいけど。 どうやって、私もスクショで撮りたいんですけど、これスクショで撮るにはどうしたらいいんだっけ、iPad って。スクショできた？じゃあ送って。よろしく。iPad のスクショはよくわからん。できるんだけどね。iPad のスクショはできるけど、やり方がよく